Okay, we're going to look into the heart today. We're going to look at the structure of the heart, the layers of the heart, how blood flows in and out of the heart, and the general physiology of the heart. Then also we're going to look at the electrical conductivity of the heart. So quickly, let's look into the structure of the heart and see how it looks like and examine these parts that I've just talked about. Okay, as you can see, here is just a rough sketch of how the heart looks like. It's just a rough sketch to show to you about the heart. First, we would like to look at the layers of the heart. You're going to see the heart has this layer from the outside, then in this middle part, and then the inner part. In the outside, we have the layer known as pericardium. This is the pericardium of the heart, the pericardium. Then we have the middle layer known as the myocardium, the myocardium. Then we have the inner layer, which is called the endocardium. Okay, so we have three major layers of the heart. The outside layers, as you can see, is called the pericardium. The middle layer is called the myocardium. This part that you see I'm showing to you is the myocardium. Then inside the heart, inside we have the endocardium of the heart. Okay, now how is this heart divided? From the structure, you can see that the heart has a longitudinal division, which is called the heart septum, the septum of the heart. It divides the heart into the right and into the left, as you can see. And there we have the upper chambers of the heart, which is called the atrium. Then we have the lower chambers of the heart, which you are seeing here, known as the ventricle. So with this, we have the right side of the heart here. Then we have the left side of the heart here. Then here the we have the right atrium. Then here we have the left atrium. Then here we have the right ventricle. Here we have the left ventricle. Looking at the right atrium, there's an opening that leads to a very large vein. These veins are what takes blood into the heart. What is this vein called? It's called the superior vena cava. Superior vena cava. And we have the what? The inferior vena cava. What is the function of the superior vena cava? All the blood flowing from the head, all the blood coming from the head, the neck, the upper limb, they all flow into the superior vena cava and enter into the right atrium. Then all the blood flowing from the lower part of the body, the abdomen, then the lower limbs, they all flow up through the inferior vena cava into the right atrium. So blood coming from the lower part of the body passes through this vein called the inferior vena cava, while blood coming from the upper part of the body passes through this vein called the superior vena cava, and they all enter into the right atrium. Please note the blood coming from this part of the body passing through the inferior and the superior vena cava into the right atrium is deoxygenated. Deoxygenated. What does that mean? Blood that does not have oxygen is what goes into the right atrium. In the right atrium, we have the valves. We have a valve called the tricuspid valve. That is this valve you are seeing here. It's called the tricuspid valve. Then on the left atrium, we have another valve, which is this one you're seeing here. It's called the bicuspid valve. These are the two valves that leads into the lower chambers of the heart, which are the right ventricle and the left ventricle. Okay, quickly, let's run through the physiology of the heart. When blood flows into the heart through the inferior vena cava and the superior vena cava into the right ventricle, the right atrium, these valves open for the blood to rush into the right ventricle. So when the blood is at the right ventricle, the blood pumps and passes through this channel into this valve you are seeing here, which is the pulmonary valve. There is a valve here through which the blood passes through, and the blood enters into this channel, which is known as the pulmonary artery. The pulmonary artery. Okay, the pulmonary artery. Then the blood flows through this pulmonary artery out of the heart. With this, the blood is taken out away from the heart, and it goes for what? Pulmonary circulation.